The nutrition-focused physical assessment is a tool used by registered dietitians in order to identify criteria that's found within malnutrition diagnosing. Criteria includes weight loss, poor PO or inadequate nutrient intake, the loss of fat tissue or lean muscle tissue, edema, and when adequate functional status. The assessment aims to identify criteria early on in a patient's admission in order to prevent malnutrition from worsening. The next part of this video will go over the nutrition interview and then show the nutrition-focused physical exam. Please read the attached document for the rationale behind some of the interview questions along with details about the nutrition-focused physical exam. Cheryl?
Yes.
Can I come in?
Yes.
Hi there, what's your last name?
Hi, Raka,
And your date of birth, please.
11/20/1955.
Thank you for sharing. My name's Nina, I'm a dietitian here. I wanted to talk to you a little bit. Is now a good time?
Sure.
Okay. Who brought you to the hospital?
I have a rash and I have kind of a loss of appetite.
Oh, really?
Yes.
Okay, well, I'm sorry to hear that, and I hope we can make things better for you. We're all here to help.
Okay. Great.
So, is that your main nutrition concern, or do you have any others?
That's pretty much it.
Okay, so you've had a loss of appetite.
Yes.
So you're eating less than normal?
Yes.
Would you say you're eating less than 50% or 75%?
Not too much, maybe half, I guess.
Yeah,
50%.
half the normal?
Yeah.
Okay. All right, do you take any nutrition supplements at home, like supplements like protein shakes or Ensures?
I take vitamin supplements, but I don't take Ensure.
Okay, so like a multivitamin?
Yes.
Okay,
Yeah.
good. Do you follow a special diet at home?
No,
No? Okay. All right, good. Do you have any food allergies?
I don't believe so.
Any problems going to the bathroom? No? Any nausea or vomiting in the past 24 hours?
No.
Okay. Excellent. And you said you've had some weight loss?
I feel like I've lost a couple of pounds.
Okay, what's your weight?
137.
Okay, and your height?
5'4".
Okay. Do you know what you lost weight to?
I think just because of the lack of appetite.
And what is your weight since you've lost weight?
Well, I was more than 137, so I've lost a couple of pounds.
Oh, okay. Do you remember what that weight was?
I think I was about 140.
Okay, and what was the time frame? Like a week or a month?
I think it was in a week and a half.
Oh, wow. Okay. So about 7 days or
Yeah.
so. Okay, very good. So I'm just going to do a quick exam to see if you've lost any muscle or fat since you told me you had some weight loss. Is that okay?
Sure.
Okay, great. Let me just grab some gloves.
Okay.
Do you have any pain anywhere?
Yes, I have pain in my hip, and it's on the same leg as the rash.
Okay. All right, so we'll just be careful about that, okay? I'm going to start at the top and then work my way down, okay? If you have any changes in your hair, any thinning or falling out,
No.
okay? All right, I'm just going to feel the muscles here in your face. Does your face look thinner to you?
Yes, just around my cheeks.
Oh, your cheeks?
Mm-hmm.
Okay. All right, good. Okay, so I'm going to shine a light in your eyes. Okay, it's a little bit bright.
Mm-hmm.
I'm just going to have you follow my finger. Keep your head still and follow my finger this way. Okay, very good. And then this way. Okay, very good. Any changes in your vision at night?
No, not that I've noticed.
Okay, good. Now I'm just going to look at your mouth, okay? Are you able to stick out your tongue for me? Okay, great. Can you smile big? Okay, good. I'm just going to lower your bottom lip. Do you wear dentures?
No.
Those are your teeth?
Yes.
Okay. Do you have any trouble chewing or swallowing?
No.
No? Okay. No pain in your mouth or any concerns?
No.
Okay, great. Looks good to me. Okay. I'm just going to work my way down, check some of your muscles, okay? Okay, so I'm going to have you grab your hand. Thank you. And have it lift about 90-degree angle. Very good. I'm just going to feel your arm here. Okay, good. Just going to feel your back. Could you lean forward a little bit? Okay, very good. Are you able to push on my hand? Yeah, just push the best you can. Good job. Okay. And relax. I'm just going to work my way down. Try your arm here, okay? Just going to look at your skin. Good. Do your hands look thinner to you?
Yes.
Really?
Yeah.
Any changes in your nails?
No, they're good.
Okay. Can you make an okay sign for me with this hand? Okay, good job. Okay, good. Relax that arm. Gonna move over to this side. Okay, same thing. Can you make an okay sign for me? Very good. And no changes on these nails, right?
Right.
Okay, good. You drinking enough water these days?
Yes, I believe I am.
Okay. You able to push with this hand a little bit? There we go. Just on your back. Could you lean forward just a little bit more? Okay, good job. Just feeling your spine and your side. Okay, good. You can relax now. Okay, we're just gonna move down and check your legs, okay?
Yeah.
Okay. This is the leg that hurts, right?
Yes.
Okay. Any changes in your leg muscles, do you think? Any weakness?
A little bit in the leg with the rash.
Okay.
Yeah.
Good.
And I haven't been exercising either
Really?
because it was bothering me. I have a little pain in my hip.
Okay, what were you doing for exercise?
Boxing.
Okay. So a lot of moving around, walking, stepping.
Stepping.
Yeah.
Yeah. And some jumping.
Okay.
Yeah.
Any swelling in your legs?
A little bit of my ankles, like at the end of the day.
Okay. It's kind of the end of the day. See a little bit here. Could you extend your feet out to about here? Okay, good. Are you able to move your feet up and down like you're pressing on the gas pedal? Okay, good. Keep doing that for me. Okay, good job. No pain there?
No.
Okay, good. Relax. Good job. Okay, that's about it for the physical exam. So now we can talk a little bit more about the food you like to eat and maybe how you've been eating at home and find out how we can help you with your appetite, okay?
Thank you.
The nutrition-focused physical assessment has been shown to enhance the nutrition care process. The assessment provides an opportunity to gather current and patient-stated information about their nutrition intake and weight history. Taking the time with the patient builds rapport and shows them that you truly do care about their status. Detailed information that may not have been collected in a previous quick assessment and interviews may now be freely discussed by the patient. Evidence supports that the exam helps the RD to collect evidence in order to support certain PS statements, especially those involved in malnutrition. The intervention further provides a base for the monitoring and evaluating criteria. It strengthens the profession as the RDs become a prime investigator in nutrition care, and they may reveal some information about patients that the physicians and nursing staff may have overlooked. Completing such a thorough nutrition-focused physical assessment has strengthened my skills as a dietitian, and it's enhanced my role in the medical team. It's helped me to develop specific, measurable, accurate, reliable, time-based nutrition care plans that help to identify and set goals for my patients. I look forward to continuing to implement the nutrition-focused physical assessment in my practice and getting more efficient at it. I also look forward to learning more about the malnutrition changes and identifying it in special populations, sensitive populations such as the elderly, obesity, and other conditions. After evaluating my nutrition-focused physical assessment, I believe there are several things I could improve upon. First, I could definitely talk slower. I could improve on my questions in the way that I ask them and make them more clear. I could ask more open-ended questions and have more prompting rather than narrowing in on certain information. I could definitely become more confident in identifying fat and muscle wasting, and I think that comes with practice. And I could improve on evaluating on the micronutrient areas. I used to think that looking for micronutrient deficiencies was out of my scope of practice. However, in such a fast-paced environment, I found that it actually helps the medical team identify issues that need special attention, those that might require a multivitamin or other supplementation that may have been overlooked. After performing the nutrition-focused physical assessment for a little over a year now, I've definitely become more comfortable touching patients. I must admit that I was once in the mindset that dietitians don't touch patients. In fact, the dietitians I trained with, they didn't touch patients. They were in the mindset that that was only for doctors and nurses. So one of my positions required that I learned how to do the exam, and we were all required to get trained and implement the process. So the peer champion team was started, the RDs were all part of the team, and the hospital started focusing on billing, physicians, and other staff to get involved in this as well. It was serious, and it opened a lot of opportunities for the important role of dietitians. The exam was no longer an option, we had to do it. Plus, as a preceptor, I had to know how to do it in order to help the dietetic interns. So I put it into perspective, and I thought about how beneficial it actually could be to clinical practice. At one point, I worked outpatient, and we had to do blood pressure, pulses, waist circumferences, and other measurements. So how is this any different? It took some time to get comfortable doing it at first, but after a few exams, I started to feel like a pro. The next step was to really learn about what I was looking for and then how to add that to my documentation and translate it in the right wording. So I will continue to learn and implement the nutrition-focused physical assessment and exam in my practice, as I really believe it's built stronger connections with my patients and helped to build rapport. It helps to build a stronger nutrition plan for their care and prevent malnutrition and worsening of other disease states.